Thank you again for joining us today for reviewing a year in progress and what's on the horizon, increasing access to Medicaid school-based services. My name is Jean O'Connor, and I'm the director of the Medicaid School-Based Services Technical Assistance Center. We're really glad that you're here today. We're really excited to welcome you back to a new school year and a new year for the TAC. Today, we're going to talk about a couple of things. I'll go over our objectives in just a minute. We're going to provide you with an overview of the Technical Assistance Center for those of you who are just joining us. We'll talk a little bit about Medicaid school-based services grants and the current progress, including a state panel with Alaska and Oregon. We'll talk about upcoming TAC events and reports, conclusions, and then we'll adjourn. We also would like for you to know that you can ask questions using the Q&A tool located at the bottom of your screen. As time permits, we'll respond to those questions or ask our panel. Thank you again for joining us today. Today's webinar is intended to provide an overview of state progress toward increasing access to Medicaid school-based services. This webinar will review milestones from the past year, describe TAC resources available to help states understand the various topics associated with Medicaid SBS, and describe how Medicaid SBS is currently delivered across the United States. We'll identify the work of states that's ongoing in implementing and establishing school-based services programs, and identify those forthcoming TAC events and resources for this upcoming year. Before we dive in, I'm excited to introduce Kate Guinness, a Senior Policy Advisor with the Centers for Medicare and Medicaid Services in CMCS. Kate, welcome.
Thank you so much, Jean. I am delighted to be here. And I just want to say I'm here on behalf of Dan Tsai and the leadership at CMCS, who are really thrilled at the work that has happened so far and the work that is upcoming on sort of expanding and improving and enhancing school-based services. As I think most folks know, on June 25th, 2022, President Biden signed the Bipartisan Safer Communities Act into law, and that is really what began this work that is targeted towards increasing access to Medicaid-funded school-based health services, reducing administrative burden for schools, supporting federal compliance with IDEA, ensuring ongoing coordination and collaboration between Health and Human Services and the Department of Education. And that's really, that's at the federal level, but we're hearing about that happening all over the country, which is very exciting, and really providing information to state and local education agencies on how to utilize the funding to ensure payment under Medicaid for assistance provided in school-based services. And last May 2023, the comprehensive guide came out, which we were very excited about, but was really the launching, I would say, of the work that then the Technical Assistance Center has done such an incredible job of helping us move the work forward over the past year. So this is the timeline, which I will not read because you all can read it, but I would say that this year, last year, probably our most exciting event was the launch of the TAC, which sort of simultaneously was simultaneous to the release of the guide. This year, we put out a notice of funding opportunity, and states have now been granted and have started work on using the $50 million that was appropriated in the Bipartisan Safer Communities Act to improve the services that are coming to kids. And so we are really excited about what has happened so far. We're excited about the 18 states that have gotten grants and the rest of the states that are also engaged in this work. So we expect that the coming year will be just as exciting as the year that we're summarizing today. So thank you very much. And Jean, I will pass it back to you.
Thank you, Kate. We're really excited to be here, and we're going to give you a brief overview of the TAC before we move into our panel. Just like Kate said, CMS and ED, the Department of Education, share a commitment to children and youth and work together with the Technical Assistance Center to ensure that children have the health services and supports necessary to build resilience and thrive in school settings. The TAC seeks to assist and expand the capacity of state Medicaid agencies, state education agencies, local education agencies, and school-based entities to provide greater assistance to Medicaid-eligible children and youth in K through 12 schools. And the tax activities, as many of you probably know, include developing specific resource materials, responding to questions via the CMS Medicaid mailbox, and convening large and small stakeholder group calls. Some of the activities that we engage in are intended to help support all of you and other stakeholders in the community in expanding school-based services and helping cover costs for school-based services that must be provided. We know that this is a complicated endeavor with a lot of moving parts. And so we're really here to support you in that ultimate goal of increased access to Medicaid in schools. During 2023-2024, the Technical Assistance Center was very engaged with many of you. We responded to more than 1,045 contacts, sent through 16 outreach messages, including webinar invitations. We held 8 national webinars, reaching 1,200 attendees, 5 virtual meetings, reaching over 700 attendees. We posted 50 FAQs on the CMS website, and I did want to note that the Medicaid SBS website has been updated as of today. So if you haven't seen the new material that is located there, we encourage you to visit that website. We posted 5 resource documents last year in response to the items and the questions that many of you asked about, and responded to over 400 inquiries to the school-based services mailbox. We share this with you so that you know that we are here to support you, and we look forward to the upcoming year and responding to even greater numbers of inquiries and holding additional webinars, which we'll talk about in just a few minutes. These are some of the webinars and virtual meetings, the titles we held. These the meetings that we held. These are also some of the resources that were posted on the website. All of these materials are now up on the Medicaid.gov website, so we invite you to visit and review these materials if you have questions or would like to learn about any of these topics and might have missed the webinars or virtual meetings. We also wanted to share with you some highlights from previous state panelists at TAC events. We wanted to share with you some of the work that some other states have done. And so you can see here some of the states that have been featured on the webinars. I'll talk about these in just a moment, but did want to invite you, if you are a state that isn't being featured today or hasn't been featured on a past webinar and you have a best practice or information you'd like to share with other states, please let us know. We'd be happy to see how we can incorporate your best practices and findings with other states. And what you see here are some examples. So Colorado, the Medicaid agency, participated in the webinar around understanding rate setting and cost-based interim payment methodologies. Massachusetts participated in a virtual meeting around comprehensive school mental health systems and shared what they're doing. New Mexico's local education agencies participated in the primer for local education agencies on Medicaid SBS. And Michigan, Minnesota, and Colorado were featured on a webinar around provider billing for mental health services. We really seek to share your experiences and best practices through the Technical Assistance Center. So again, if you have something that you'd like to see presented, we'd invite you to share that with us, or if you'd like to volunteer to share what's working in your state, let us know. A couple more highlights here. You see a Connecticut provider came and helped speak about promoting mental health and well-being in schools. Michigan shared about their fostering program integrity for Medicaid SBS practices. California and Tennessee talked about the intersection of Medicaid, managed care, and SBS. And Rhode Island shared their experience testing out the readiness checklist, a comprehensive tool to assist school-based services with their SPA submission and compliance. We're also really excited to share with you a little bit about the progress around the Medicaid school-based services states and the grants that they have received. So what you see here on this slide is an overview of how Medicaid SBS expansion has occurred. This is the current landscape here in the US. And you can see in the map, we have a key down below. States with green have indicated that they are fully expanded. States with blue are partially expanded. Yellow expanded through legislation, but have not yet submitted a state plan amendment. And the states we see here notated in gray have not expanded. But we're excited to share that the states with the asterisks in purple are states that have been selected to be CMS school-based services grantees. These grants that were awarded to the states that were just listed on the prior slide were awarded to fulfill part of the directive of the Bipartisan Safer Communities Act, which required that $50 million be appropriated for fiscal year 2022 to disseminate to states for the purposes of implementing, enhancing, or expanding the provision of assistance through school-based entities under Medicaid or CHIP. This funding is intended to allow states to build additional partnerships and coordination between the state Medicaid agencies and the state educational agencies to improve the quality and the delivery of care. And as we all know, schools really offer this unique opportunity to deliver healthcare from preventive to behavioral health to physical care. And really, these are evidence-based approaches to advancing children's health and improving educational outcomes. So what you see here are the states that were awarded grants, kind of laid out in a little bit of a different way. On this slide, you see the categories of grants that were awarded to different states. So we have our implementation grantees here on the left and our enhancement grantees on the right. Enhancement grantees were Kentucky, Massachusetts, Minnesota. Our expansion states were Delaware, Nevada, New Hampshire, North Carolina, Oklahoma, and Pennsylvania. Our implementation grantees, Alaska, Kansas, Maryland, Oregon, Rhode Island, Vermont, Washington, West Virginia, and Wisconsin. So very excited for these states. The states that these states are going to be participating in technical assistance with us in the coming year. We're excited for you to hear today from two of those states. We have Alaska and the state of Oregon here with us today. We have Crystal Hayes and Betsy Wood from the state of Alaska. And we are joined by Jennifer Smith from the Oregon Health Authority. Rusha is unable to attend, but we're excited to talk with these panelists and hear from them about their perspective and some of the things that they are going to be working on with their grants. So we can have the panelists join us on screen here. Welcome, welcome, Betsy and Crystal and Jennifer. Wonderful. Thanks for being here with us today. We'd really like to hear from you and just about your state's progress in expanding Medicaid SBS. So we'll just kind of talk through some of these questions here. And if we get any questions from the audience, we may add those into our discussion as well. So we'll get started. And I'd love to hear first, Jennifer, from you in Oregon, if you're willing. And then we'll turn to Alaska to hear from you about the progress your state has made in expanding Medicaid school-based services.
All right, fantastic. Hi, everyone. I'm Jennifer Smith, Oregon Health Authority. Thank you for having me today. I'm really excited to talk about our program. So the progress that we've had in expanding Medicaid school-based services is, and you'll notice we were green on the map, that we had fully expanded. And That's because we do have 2 state plan amendments that have been approved by CMS. We have one that was approved in May of 2023 that included non-IDEA services. So we expanded the service types that would be available and also the plans that would allow for those services. So not just individualized education program, individualized family service plan, but also 504 accommodation plans and other individualized plans of care. So that was May 2023. We have updated our rules, our Oregon administrative rules for this program to align with that state plan amendment. Those rules were adopted on September 6th, so very recently, and we're still working on implementation planning and operationalizing those rules. Our other state plan amendment that was approved in February of 2024, allows school counselors, school psychologists, and school social workers that are licensed by our Teacher Standards and Practices Commission, but are not otherwise licensed as recognized providers for providing Medicaid school-based services in schools. We expect to update our Oregon administrative rules in 2025 to align with that. And also training and technical assistance for education agencies. We're working on a training plan. We are in partnership with our Department of Education and we are also contracting with West Ed, specializes in school Medicaid. We are working on provider guidance. We have a webinar series coming in this fall. We start next week with our webinar series. We're going to have 2 webinars a month through the end of the year. And then we have some forthcoming potential engagement. So we're kind of putting that together right now, talking about possibly focus groups with education agencies and partners to determine the needs and program adjustments as we move forward. And then, of course, we're working on onboarding tools and documents for education agencies to begin billing. So that's kind of where we are. That's our progress as a state in expanding Medicaid. And I want to pause there before I move on and see if anyone has any questions or comments.
Jennifer, that is, you just identified quite a few things, and I really want to ask you some questions about a couple of those. When you're ready, and before we dive into some of those, especially about the training plan in particular, I want to let Alaska also give us a kind of a brief overview.
Sure, thank you. So my name is Betsy Wood, and I'm the Associate Director for the Office of Health Savings. We are a team located within the Commissioner's Office at our Department of Health that's focused on Medicaid policy development. Crystal Hayes, my colleague, is here with me today, and she's also part of the team, and we're our SBS grant team as well. You will notice that unlike Oregon, Alaska on the map was gray because we are at a different stage in our journey towards enhancing and implementing school-based services in the state. But we have had some really great progress this year that we're really happy to share. One piece in particular is that in addition to the parameters in our state plan and in our regulations, we had statutory limitations in Alaska statute that limited school-based services to those that are documented in a student's individualized education plan and that were provided to a student with a documented disability. So that statutory limitation really tied our hands when we started to look at what can we do for students and how can we help schools access Medicaid reimbursement for a lot of services that they're providing. So we're really happy to share that in last year's legislative session, we introduced a bill to remove that statutory limitation, and we're successful in getting that through the legislature this last year. So that bill recently took effect, and that piece, removing those statutory limitations we've been working with, will go into effect in July of 2025, which gives us a little bit of time, not much, but a little bit of time as we start to work with our operational teams, and then really work through our grant too, to say, how do we leverage that statutory removal and make sure that our, any changes to our state plan or to our regulations really allows us to kind of leverage that and look at how can we provide supports for districts that are billing or that would like to bill today. I think this is going a little bit into the next question, but when we look at how widespread is school-based services billing across Alaska, the answer is it's not. We only have 6 out of our 54 school districts that are currently claiming for school-based services. And, in our preliminary work with our local education agencies to see kind of what's the hang up. I think there are a lot of hang ups, but there's a lot of low hanging fruit for us that we think we can address pretty quickly, and ideally kind of start to move the needle in the right direction. And Crystal, if you want to introduce yourself and if there's anything you'd like to add too, feel free.
Yeah, thank you, Betsy. I'm Crystal Hayes. I'm also in the Office of Health Savings within the Commissioner's Office. And Jean, we'll just kind of go right into that second question if you don't mind, and then we can pass it back. So 6 out of our 54 school districts are currently billing. A majority of those districts that are considered part of our road system, or on the map basically. So they're part of the road or state marine highway system. And so for rural schools that includes tribal school districts, we are hoping that this grant and our next couple steps with our contractor as support will really make sure that we're reaching out to those rural stakeholders to gain a better understanding of what they need, so that we can provide that support and allow them this other avenue of funding in order to pay for the services that they're already providing. So, that's just a consideration that we're taking. And when we talk about rural, we're talking about very rural and sometimes very, very small school districts. So we want to make sure that we're bringing our stakeholders to the table as we're in this implementation phase, to make sure that whatever step we take next includes all of our partners.
That's great. Yeah, that's terrific. And I think part of what we do want to feature here and this conversation is really kind of talk about, being in different places on this journey, because every state is in a different place, whether that you have a grant or don't have a grant or have a SPA or not. States are all in very different places. And both states have some unique geography. So I want to go back to Jennifer and just kind of ask, can you talk a little bit about your LEA participation? I mean, Oregon has a really long history of doing innovative things with Medicaid, but I'm curious kind of where you feel like you're at.
We're not where we want to be with participation, that's for sure. We have 197 education agencies in the state of Oregon. That includes education service districts and school districts. And we have about 25% of them participating. And the distinction there is that the early intervention and early childhood special education programs are required to bill Medicaid. Most of that 25% is those. So we don't have a lot of K-12 enrollment and Medicaid reimbursement in Oregon. So we'd like to change that. And then most of Oregon is also rural, probably not as rural as Alaska. I'm pretty sure we're not as rural as Alaska, but the majority is. And the unique barriers to participation in school-based services for those rural school districts is just administrative complexity, the associated costs for participating and even hiring or contracting with medically qualified individuals, those kinds of things that are happening in rural communities. And then we also have 9 federally recognized tribes in Oregon, and we have an Office of Indian Education. So the schools on the reservation or trust lands are governed by their respective tribal governments, and they don't participate in the SBHS program, but we do have a lot of tribal members that attend public schools. So that local school district that enrolls those individuals would be responsible for the free and appropriate public education and also school-based services.
That's really helpful. We're getting some really good questions that are coming in through the chat, and I want to get to some of those in a minute. But I want to ask you both, because Oregon has this long history and isn't quite yet where it wants to be. Alaska is kind of beginning this journey, trying to enroll more local education agencies. Alaska folks, Betsy and Crystal, congratulations on your, getting your legislation and needs kind of addressed there. But I'm really curious for both states, like, what do you see as your barrier? Sort of what now, like with what's ahead, what are some of the challenges maybe that are on that kind of critical path to expanding Medicaid SBS and continuing to move forward? And then some of the questions that are coming in are really about stakeholder engagement. So we'll get to those in just a minute. So who wants to go first?
I can go first. I don't mind. So I really think that our biggest challenge in Oregon is infrastructure needs. So we have a shortage of providers in Oregon, especially in our rural communities, but we also don't have like a single system for education agencies to use, both for student records and for health services. There's no consistent statewide uniform way of doing that. So districts are all doing it differently, and some of them are contracting with vendors to help with billing, and some are not. Some are doing it on their own. Really building that bridge between education and health. So when we're talking to education agencies, their primary focus is education. It's not health. So understanding as a Medicaid agency that these are atypical medical providers, that the communication needs to be different, the guidance needs to be different. We need to speak to them with that focus in mind, and not just like we would speak to hospitals or clinics or anything like that. So those are our biggest challenges: infrastructure, staffing.
What about Alaska, Crystal and Betsy? What do you see?
I would say that we actually see a lot of the same or similar challenges. I think, across Alaska, we have 229 federally recognized tribes. So the tribal health system is a really integral part of healthcare delivery. And we don't have the same type of kind of tribal education system, I think, that we were describing in Oregon, but just when we think of rural in Alaska, a lot of our rural communities are predominantly tribal communities. And so there's a really strong link between, how schools, the role that schools play in small communities, as well as the role that the tribal health organizations play in communities. So I think that's actually, you asked about challenges. I think this is a strength. So maybe I'm jumping ahead, but that gives us an opportunity for a lot of integration in our rural areas. But when we do look at challenges, I think what we have seen is that what we've heard from our school districts is kind of a similar thing, that we have a lot of educators who are not healthcare providers, who are trying to document services that are provided to students under an IEP. And if they want to then translate that documentation into something that Medicaid can look at and accept and pay for, it needs to, in some cases, be documented in a different system, or there are different requirements. They don't quite speak that medical language. And so they don't really, that bridging that gap is something that isn't at the forefront of our educators' minds, because they're focused on educating students and providing services, the required services to students. But that documentation piece and how do we kind of get everything into Medicaid language is a little bit difficult. So we're also really have heard from districts that that capacity is a really tough thing. You know, people are stretched really thin. Everybody, I think every state is facing budget pressures in every area, and in Alaska, it's no different, particularly in the education world. I think there's a lot of budgetary pressures on schools across the state, and trying to maximize their resources is really difficult when their primary concern is educating students. And so it's just really hard to figure out how and when and who to redirect those efforts into, you know, the Medicaid claiming world. And so that's where we're really hoping that we can, through our work and our partnerships, come in and find some ways to streamline the process and make it a little bit easier for educators, so they don't have to work as hard to bill and claim services on the Medicaid side. Crystal, is there anything that you'd like to add?
Yeah, and I think going back to what Oregon is saying about, a centralized system, I think we've heard that from the schools that we've talked to in our preliminary needs assessment, and the fact that we have local control in Alaska. So, the school districts or the local education agencies have to have the buy-in if we wanted a central entity to kind of act in that capacity as we move forward in the implementation of Medicaid SBS, and seeing if there's different school districts that are, willing to draw down on this opportunity. I think that there's definitely a lot of interest in our state right now with the 2023 CMS guidance. That got a lot of people really excited and really talking about it. And so, like Betsy had said, we have a lot of partners at the table. And so it's an exciting moment to kind of take those partners. And then when we have our contractor on board and to fulfill the requirements of the grant, working with the needs assessment and the infrastructure needs assessment component of the grant, and really being able to draw down on specifics to kind of guide us as to what exactly we can do to help the local education agencies, but also the state education, our partners over at the Department of Education, but then also, for us within the state Medicaid program, is there ways that we can streamline and make more efficient our own internal processes? So there's definitely some challenges, but also some great room for improvements.
Great. Thank you. Yeah, I think something you said in there about local control, I know probably resonates with a lot of states that have, school districts are relatively autonomous agencies in a lot of states and have a lot of say over how they do their own work. And so that buy-in piece is really important. We've got a couple of people who have asked questions about providers. So I want to switch gears for just a minute. The two questions we have are about how you've worked with providers, especially PT, OT, speech, social workers, to engage them, or how are you planning to do that? And then kind of embedded, I think, related to that is a question about how they're licensed in each of your states. And so I'm wondering if either state wants to take that on, those questions.
Sure, absolutely. I'll go first again, if that's okay. So we do engage with, first of all, the licensing boards. We engage with the licensing boards. We make sure that we are aligned with their rules as well. But then when we're providing any kind of onboarding or training to education agencies, we have sessions that are specifically for medically qualified individuals. So we have connections at the OT board, PT, speech. I don't know if we have a connection at social workers, but with the nursing board, and we work with all of them kind of individually and go back when we do rule changes. Like when I just went through this iteration of the rule changes, we're connecting with those boards. We're connecting with the other Medicaid programs where there may be some crossover. And then we do have board licensure for each of those individuals. We do allow also, we have a specific set of speech language pathologists that are I don't think it's licensed. They're certificated by that Teacher Standards and Practices Commission. And we also allow them to provide services in the schools. But we are open and available to medically qualified individuals working in the schools just as much as to the education agencies themselves.
Great, thanks. And Crystal?
Yeah, so this is near and dear to my heart because I am a speech pathologist by training. So there is some concern with our, our school-based SLPs and related services providers about the difference in licensure or requirements between what they currently have with IEP and then now with this statutory change, and as we move forward with the other change to implement the statutory update about what to do if there's a change in the licensure and other requirements for those school-based service providers. And that's something that we're planning on working through with our contractor as we move forward in our stakeholder engagement and needs assessment, making sure that we're reaching out to our Alaska chapters of those professional groups and really addressing those issues on the front end so that once we are able to kind of put this into practice in schools, we have already done some outreach preparation and making sure that if we don't have a perfect answer to start with, we at least have a plan to get a bridge in place for where they currently are versus where they need to be when we go live with the changes.
Thank you. That's really helpful. I know we've heard from a couple of states that they are kind of trying to work through what it means because there are some providers that are working in school systems that can do that, for example, without certain kinds of licenses, or they have a different level of licensing for the type of work they do in schools and what it might mean if they are to need or to want to build Medicaid for their services, sort of how do those things align? So we know these are real challenges for states, so it's interesting to hear kind of what's happening on the ground. I want to turn back to Jennifer for just a minute. And Jennifer, you talked at the very beginning about training, and I've been wanting to get back around to that because I'm really curious. I think it seems like you're doing some innovative things there. So would you mind sharing a little bit more about kind of your plans for your grant and specifically as it relates to training?
Yes, absolutely. So I know I mentioned that we have contracted with WestEd. They're a research company in California that is primarily working on school Medicaid. So it was great to connect with them. And I do have some of our plans kind of coming together. We're still talking about a lot of things, but we are really bolstering our guidance. So provider guidance that is just very consistent, very thorough, because again, we're speaking to education agencies, not clinics and hospitals. So we're working on that. We have a fall 2024 webinar series, and that will likely continue past fall and having webinar series moving forward. But since the rules were just adopted, we're going to get information out about the rule changes and the significant changes and steps that education agencies can take in order to participate in Medicaid reimbursement. And then we also have some ideas about having focus groups with education agencies and partners to determine the needs for the program and any program adjustments moving forward. We have done more engagement this year than I think historically we've ever done with education agencies, associations. Even through the rule changes, we would have weekly meetings and go rule by rule and talk through everything and what works for education agencies. And then we have, and I don't know if this is true of every state, I know Oregon, we have 19 education service districts. And then I'm not adding very quickly, but the rest of the 197 districts are school districts. So those education service districts are designed to be kind of like hubs for their areas, school districts. And we would like to engage the ESDs and get some buy-in from them in order to kind of build that out and make that work also for school Medicaid. Is that helpful?
Yeah, that's really
Okay.
great. That's really great. It's really exciting to just hear about the things you're working towards, and the education service districts is also something that we know a few states have brought up, and sometimes folks are interested to think about kind of how they can engage with those agencies to try to get more reach to the kind of work that they want to do, or to make things easier for their school districts, especially as we've been talking about kind of rural and tribal and where there might be kind of limited capacity. So that's really interesting to hear the work that you're doing there. We have a couple of minutes left, so I wanted to ask both Alaska and Jennifer. We'll start with Betsy and Crystal, but is just, what advice would you provide to other states, either Medicaid or education agency leaders, about kind of the Medicaid SBS journey? We have almost 300 people on this phone call, and probably ranging from states where they're not, getting a lot of movement toward Medicaid school-based services because they may have other priorities or things on their plate, to states that have, moved really far along. So really interested, just you're both implementation grantees, but you're both in very, different places as well. Any advice or anything you'd like to kind of share with your fellow state colleagues?
Sure, I can start in. So, I think this is probably what you'll hear from a lot of folks, but really just building those relationships and those partnerships with the stakeholders that are engaged is just critically important, and also trying to build on work that's already occurring kind of in the same vein, but in other areas. For example, our state education agency has a large effort that they're kicking off around behavioral health in schools, and we're trying to align our efforts alongside our education agencies so that we are kind of walking hand in hand and working with the same group of stakeholders and moving in the same direction. We also have done laid some groundwork with behavioral health listening sessions, and a project that we've done at the Department of Health prior to kind of entering into this world again. So we're really trying to just build on efforts that are already ongoing, so people don't feel as though we're duplicating. And I would say some of the most impactful movement that we've seen, or kind of partnerships or relationships we've built, have been through kind of one-on-one or smaller group listening sessions. And maybe that's more relevant or easier to do in Alaska because we have, a smaller, it's a smaller group of people, we have less districts. It's a little bit easier to make those connections. But I would say in a lot of the listening sessions, I think we, did upwards of 15 in advance of applying for the grant, which, when you think of our 54 districts, is not terrible. But we heard similar things, but kind of nuanced to different things from our different districts. And just taking those opportunities to really understand what the on the ground challenges are, I think has been really helpful, and has informed our work as we try to kind of focus, how can we be helpful instead of one more thing that people have to engage with when they're busy doing other things too. Crystal, is there anything else that you'd like to add as far as, what has worked well for us, or what advice we'd give?
I think, to Jean, your point, with like states that are struggling to get traction in the world full of competing priorities on everybody's plate. I think one thing that we've found just in our preliminary needs assessment is, like, what can the state Medicaid agency do that are maybe simple, low-hanging fruit changes that we can make that ultimately makes it easier for our district partners. And then, broadening that to, is it, by giving them the time back to make something a little bit easier administratively in their day, that gives their time back to serve that student, that child in that situation. So sometimes starting with those small incremental steps could be helpful for a state on the internal process side, rather than trying to reach out if there's other priorities within the state.
Thanks. Jennifer?
Yes. So first of all, I want to say Oregon is very fortunate. that we have several Oregon legislators that are very passionate about this work and very dedicated to moving this work forward. That has been a fire to get us going, first of all, but it's also been a good fire because we have attention and can move forward on a lot of things. So my top 3 things that I would advise, and I'll talk a little bit more about each one, is collaboration, transparency, and engagement. So interagency collaboration. We have a wonderful partnership with our Oregon Department of Education. We basically see this as a co-agency program. We meet together. We have analysts from both sides coming together at least once a week and driving this policy forward and working together on making sure that that alignment is there for education and health. And then transparency. We've been as transparent as possible. So we're communicating often and openly with education partners. And to the extent possible, we're involving them in program development. We're allowing them to inform that. And part of the way that we're doing that is having engagement. We have engagement with the districts, with associations, and we also have a school Medicaid advisory committee that's really helpful in that engagement.
Terrific. Thank you so much, Crystal, Betsy, and Jennifer, for sharing with us all of your thoughts, and we're really appreciative of your time and wish you luck with your ongoing work. Look forward to seeing you again in the near future. What I'm going to do next is turn it over to my colleague Charlotte, who's going to talk a little bit about what's ahead for the Technical Assistance Center.
Thanks so much, Jean. And I again want to echo a big thank you to our panelists from Alaska and Oregon. It's been really insightful. And I think, you know, the TAC strives to really create these kind of events where we can learn, where states can learn from one another. And I think that's super, super important. You know, you guys are the experts out there doing the work, and just really appreciate all the sharing and knowledge you guys have to offer us all. And with that, in the following slides, we're going to be reviewing the upcoming TAC events and resources that you all can look forward to in the upcoming months. So to start, in an effort to provide more technical assistance, the TAC has organized groups of states or cohorts by their current status in expanding Medicaid SBS access. So to do that, the TAC will be hosting a series of meetings throughout this year and next year, where we'll work together to help states in getting started, continuing, or advancing their efforts. States in each cohort will receive assistance from the TAC as they identify reasonable alignment goals and targets. And invitations were sent out to SMAs and SEAs with the dates and times of the first meetings identified here on this slide. Now, this map identifies the states as they were grouped into each cohort, and most states have responded with interest in this engagement and support activity. So the TAC is eager to help states achieve their goals to align their programs with the guidance and in expanding Medicaid SBS access to students in schools. State Medicaid and educational leadership are encouraged to respond to the TAC's communication and inform us of the key personnel who should be at those meetings. Also, be on the lookout for any communication from the TAC to make the most of the meeting. Some preparation work is asked of the states, and details can be found within the meeting invite. And as always, please feel free to reach out to the TAC via the mailbox for any questions or concerns. So the TAC will be offering 5 webinars this year, and we're going to review these in a second. But I do want to note that the dates that are that are there in that right-hand column are tentative, and they are subject to change. But for the most part, in November, we'll be hosting the Medicaid and CHIP funding for school preventive behavioral health services. And it's in this webinar where we will be exploring the funding options to provide behavioral health services in schools. Now, in January, we will build on the information discussed during the CDC presentation that was held last spring 2024, where we're going to bring together mental health professionals and educational experts to discuss the implementation of evidence-based strategies to improve mental health in schools. The February webinar, we will be aiming to identify best practices for billing and documentation for the most common types of Medicaid SBS services, including mental health, PT, OT, and speech language pathology. And then in March, we'll host the unique needs of the frontier, remote, rural communities and LEAs in school-based health. The event will feature speakers from states who've implemented approaches to school-based health specific to the needs of rural communities. And finally, in May, the TAC will present on the Medicaid requirements related to children with complex healthcare needs, including a panel that will discuss the solutions to reduce complexity of billing and improve the continuity of care for this special population of students. So, of the proposed webinar topics, which is your state most interested in? Now, this is that Slido. There's this link there that you can either scan with your phone or you can join by putting in slido.com and then the code of SBS TAC. And we'd love for you all to let us know of those 5 webinars that were talked about, what seemed to be the most intriguing or the most interesting for you. Yeah, billing and practices for best practices for billing and documentation. We had a feeling that might be one of the ones that garnered the most interest. This does not surprise us. We've seen a lot of questions coming in through our mailbox regarding that. We think, yes, behavioral health services is a very important topic. And obviously, we even heard how our panelists are trying to address that in their states. So have a feeling that was a really important topic as well. Okay, with that, I think we'll go ahead and move forward. Thank you all for responding. We also wanted to let you know that the TAC will be producing a number of resources based on our understanding of what states need at this time. And I'm just going to do a quick run through of what those are. There's an explainer video that's going to provide a brief overview of the Medicaid SBS. And then a Medicaid SBS 101 quick guide, really easy to access resource there. We'll have a resource on interagency agreements for state educational agencies. We'll have one on parental consent and data sharing. Again, this was a topic that we've seen a lot of questions come in through our mailbox about. And then basically an update on the readiness checklist, which we understand too has been a very useful resource, but could use some updating. So we're looking forward to producing that for everyone's benefit. So with that all in mind, are there any additional topics that your state would like us to see covered? Again, there is the QR code there in the top that you can join Slido to put in any topics you think you'd like to see covered, whether that be something specific in one of the webinars or resources I just mentioned, or something that's totally different that you think we could use some help on. If having problems accessing it, go ahead. We invite you to put that in the chat as well, so that we can get a sense of, are these aligning with what you are seeing as your specific needs at this time? Okay, coverage for prevention services, yes. Okay. See some of these topics coming up now. Additional funding opportunities for school-based mental health. That is definitely going to be talked about in the upcoming webinars. Yeah. This is super helpful for the TAC to hear because we do want to be responsive to those needs of the states. Okay. Vision hearing screening. Okay. Yeah. Care coordination by school nurses. Yeah, I've heard that one before too.
And Charlotte, I did want to tell you that we are getting some comments coming in via the Q&A from folks who are unable to use Slido. So we'll record those with the meeting notes.
That's fantastic. Thank you. And I appreciate, again, everyone responding in whatever way they can to get this information to us. It's really important. We do look at this, we review it, and try to see kind of where it is that we can help, most of the states. Okay. I think we'll give it a few more seconds here and then we'll move forward. But keep putting in your responses and we will definitely, like I said, be collecting all of that. Okay. Another resource we're putting out there, it's actually a report that the BSCA requires us to do, is where we're going to draft basically a report to the Congress and the Secretary that details the Medicaid SBS work and the activities of the TAC. I'm not going to read all that here, but just wanting to make sure the states knew that we would be putting that out shortly. So I do want to just end or wrap this up with just making sure everyone knows that we do have our next webinar coming up, and this is scheduled to go out on November 14th. And it's about Medicaid and CHIP funding for school preventive behavioral health services. I did see that topic come up a number of times in the poll, so I'm glad that that's going to be helpful to people. And we're looking forward for you to join us then. Just as a reminder, any questions that were dropped in the chat will be reviewed and addressed through the Medicaid SBS Help Desk. And, the email for that is schoolbasedservices@cms.hhs.gov. So this does conclude our presentation. I do want to thank you all for your attendance and participation. I want to give a big thank you to our states that participated in our panel. I think everyone's sharing their experiences and sharing their stories about this journey, right? We talked about it as a journey before, is so essential to helping all the states come together and advance the services and the opportunities for Medicaid billing for their students. So again, I appreciate everyone's participation. The slides and Q&A and recording will be available on the medicaid.gov website shortly. And any additional questions can be sent to the Medicaid SBS mailbox. Thanks again for participating and have a great day.